3. What to do if employee tests negative for COVID-19. If an employee is advised to self-quarantine by medical professionals, the employee must follow return-to-work guidelines from Section 5. Or, if employees' medical professionals diagnose another illness or otherwise indicate employee is not likely to have COVID-19, the employee must follow medical professionals' treatment recommendations and is not required to follow COVID-19 return-to-work guidelines. 4. What to do if employee has symptoms or tests positive for COVID-19. The employee must stay home. Notify department manager, project manager, or human resource director. Follow current CDC guidelines posted at the CDC's website for coronavirus, and guidance provided by local, state, and national health professionals. Follow the return-to-work guidelines from Part 5. 5. Return-to-work guidelines. This part outlines when an employee can return to work. 1. If employee has coronavirus symptoms, whether or not tested positive, A. A written note from a doctor that the individual may return to work, or B. If employee will not be tested to determine COVID-19 negative and not contagious, the employee has not had a fever for at least 72 hours, 3 full days of no fever without the use of fever-reducing medicine, and other symptoms such as coughing or shortness of breath have improved, and at least 10 days have passed since symptoms first appeared. Or C. If employee will be tested to determine if contagious, the employee no longer has a fever without the use of fever-reducing medicine, and other symptoms such as coughing or shortness of breath have improved, and the employee received 2 negative tests in a row, 24 hours apart. Doctors will follow CDC guidelines. 2. If employee tested positive but has no symptoms, a written note from a doctor that the individual may return to work, or at least 10 days have passed since the date of their first positive COVID-19 diagnostic test and have had no subsequent illness, or the employee received 2 negative tests in a row, 24 hours apart. Doctors will follow CDC guidelines.